I'm actually going to record this. And again, let me reintroduce myself. My name is Kerry-Ann Joseph-McLean, and my husband, McLean, and I, we are, not just business partners, but we're life partners. So for us, health is super important. We're health enthusiasts. And at the end of the day, no matter what you try to achieve in life, whether it's for a better life for your family, for yourself, a better career, higher education, a home, whatever dreams and goals you have, you need to make sure that your well-being, your health is a priority. And many times, especially as women, we tend to juggle a lot, not to exclude the men, but just to sort of like, we wear many hats. And so at times we don't take time to be able just to breathe, to be able to reflect and to say, okay, well, how is my body feeling? How am I feeling in mentally? How am I feeling, with my overall well-being? And so for me, along my life journey, we've had, illnesses in our family, we've had deaths, like I'm sure many of you have encountered. And so we all want to live a better, healthier, longer life. But seasons come, seasons go, and life happens where you are looking from, you know, outside in, attempting trying to reflect. So hindsight is 2020. We all know that. Insight is a little bit different, harder for us to get. But today I'm going to share with you some information on a few areas. I'm going to share my screen. And what I also like to do as well, I have a very dear friend who is a psychologist, and she will be sharing some information about her area of expertise. For us as individuals, I believe is important that we be well informed with the right information. And so as we go through all of this, in our life journey, gathering information and applying what you learn and voicing your concerns to either, someone who is in a particular field, whether it's through health, the body, mental health, someone to speak to a therapist, some type of practice you want to put in place, and a community of like-minded individuals, or just a community of people that you feel safe with. And so I actually wanted to share the screen. I'm going to do that right now. And like I said to you in the beginning, for those of you who have questions at the end, or you want to maybe bring up a question in the chat so we can sort of look at that towards the end, feel free. Like I said, this is a safe environment. We want to be able to have you feel comfortable as you're learning and growing together. And so I'm going to share this right now. Here we go. Awesome. Might be a technical support here and speaker at the same time, so please forgive me. Here we go, share my screen. Awesome. So we all know there are many topics that can be discussed for mental health. I don't profess to know all. Like I said, I'm not proficient in these areas. I don't have a certificate in all any of these, but like I said, I'm a health enthusiast. And some of the things I wanted to share today is things like ADHD, have a discussion on that, autism, depression, chronic stress, anxiety, overall mental health and well-being. So this part looks kind of funny, squiggly things happening, right? So the first topic I'm going to speak about is ADHD. Now, I can only speak from personal experience because I actually have a friend of mine I've known for like almost like 30 years. And she has a son, and he has severe ADHD. He doesn't speak, sorry. He has autism and he also has ADHD. So he's super active, but he's such a loving child. And so in the ADHD world, there are many factors that can have you be diagnosed as having ADHD. It could be younger age or even as you get older. And sometimes we actually are undiagnosed, especially in the Caribbean. we have like hyperactive or activity happening, but we don't realize that this ADHD as part of, could be something that could be a factor. So that's why sometimes as you can move to a country like Canada or the US, then you have the ability to sometimes determine or have it diagnosed later in your life. Now, this screen is like, I found this quite interesting. Whether you think it's ADHD or not, some people have messy desks and people have clean desks, but when you're working in the mode, sometimes it happens, right? And so the brain sometimes, this is what happens. So what's on the inside sometimes is telling on the outside, right? So ADHD, if you can resonate with this, or you know someone like this, my husband's gonna shake his head like this to me. Sometimes that's my desk looks like that, especially when I'm in the zone. But there's nothing right or wrong. It's just basically this is what's happening. And so if you're able to identify certain things, then you can know what to do to increase and to improve your health. And so some of the triggers of ADHD or ADD could be things like, food imbalance. There's a gentleman called Gary Brecker, and I actually started following him online. He's called a human biologist. My husband was following him for a while, but I went to an event in December. He started speaking about things that trigger certain conditions. And some of them actually could be a nutrient deficiency. I go, what? Okay, nutrient deficiency. Okay, let me hear more. Food imbalance. Most of the food we eat, either we eat food that are highly processed, or we eat whole food, but not sufficient enough to give us the right balance. Now, food allergies is another thing. Growing up, that wasn't something I heard about, but as I got older, I started hearing all these things that trigger food allergies. This has been determined, not by me, by the medical, world, that these things can trigger ADHD. Now, these are just some of a few things. It doesn't cover everything, but I just wanted to highlight some things. So, for example, stress hormone. When are we ever not stressed? Maybe when we're sleeping, maybe. Right? But stress hormone can happen in many ways. Like, you could be stressed, just, mild stress. You're driving and you get stressed because someone cuts you off. Your child or someone says something to you and then your blood pressure goes up, right? But then there's chronic stress that can happen. And so there's imbalance with your cortisol, you're producing more than you should. Hormone imbalance happens for many different reasons. It could be through, you're pregnant, or you're going through menopause, or you're going through this imbalance overall in your body. You don't even realize there's a hormone imbalance. A lot of, studies are coming back that preservatives and food diets are linked also to ADHD. So that's part of the ADHD. So I'm just going to highlight that with you. And then I'll get into some of the things that I believe could be something that can actually improve your quality of life in certain areas, of course. Now, another thing I want to tap into is autism. Autism is something that is a wide spectrum. I don't profess to know every single thing in autism. And so for me, doing my research and finding information through credible websites, I sort of gathered some information as to sort of covering some highlight areas. I mentioned to you that I have a friend, her son has autism severe. He doesn't speak. He should be about, I think, 15 by now. And so he doesn't speak, and the type of therapy he needs is way beyond just having the right foods. It's the balance of everything. But what I want to show you, if you know someone who has ADHD or autism, there are things that can be done that you can control, like what you consume, what you share with those you love, in the way of consumption of food. And so maximizing your nutrition in both areas is something that actually can help balance your body in a particular way if you're giving it the right food. There's a saying that, the body heals itself. Well, it heals itself if it gets the right nutrients, if it gets the right therapy, if it gets the right input, right? And so therefore, if you're maximizing that, then the body has the ability to heal itself to some ability, to some level, with help and support from different areas. More servings of vegetables and avoiding processed food. Now, if you're like me, I gravitate to chocolate, and I believe chocolate is my middle name. That should have been my middle name going forward, but I love chocolate. But the quality of chocolate is determined as to how processed it is, and a better quality of chocolate. Now, processed food, we have cravings for all of these. I was listening to a documentary yesterday, and one of the things that I learned from especially the tobacco industry is that they actually invest a lot of money into creating processed food with chemicals and leave you highly addicted to these foods. So your brain is fighting an addiction in food. And so when your stress level goes up or you have certain conditions, let's say I think autism, a person who's autistic, they may be in a situation where, change for them is not always good. So if they're put in a situation where they become highly stressed, or they're in a particular, situation where, they want to have particular foods because that's what sort of they enjoy, then we have to balance that. Another thing is that there are kids, adults who have their palate like certain things or don't like certain things, right? So I know broccoli is good for me, but do I eat broccoli every day? No. Do I have, a chocolate every day? No, but then I feel I will gravitate more to the chocolate, right? So fruits, yes. Vegetables, yes. We all know these things. But there are times when some of these foods are so depleted in nutrients because of how they're grown, you're eating for consumption and for nutrition, but not always getting the nutrients you need. So these are good ways of sort of starting the journey if you haven't done that, or if you're having a conversation in your household or with your friends about changing the way you eat, then that actually is the first step. Now, I have a friend and nutritionist, his name is Dr. Bob Bukowski, and he says if you eat right, you sleep right, you poop right, you think right, your body actually resets itself, right? So it sort of starts the engine rolling of you sort of on your wellness journey to become a better version of you. Now, in addition to the right therapy that you would get for certain conditions under the mental health label, so to speak, I'm not just speaking about ADHD or autism. There are other things that go hand in hand, like stress, anxiety is another thing, and depression. Different levels of depression can happen. I know, for example, like my mom, before she passed for not for this particular reason, but when she had her first stroke, she recovered, thankfully, within that a 2-week period, and she was able to walk out of the hospital and had to continue therapy. But with her follow-up appointments, I was actually very surprised of the questions that the doctor asked me and to be mindful of. One of the things they asked is, did I notice, at that time, did I notice signs of depression? I go, not that I'm aware of. And I was told by that doctor, the follow-up doctor from the hospital, that, anyone who has had a stroke or a heart attack, they're high risk of getting, depression. With my cousin, who is a breast cancer survivor, thank goodness, for over 5 years now, during her radiation, they had the social worker speak with her, and her mindset was actually very good. She's a praying woman, and so she had her faith in God, and so she went through the surgery, did the radiation, the follow-up, and in the sessions with the social worker, because I actually went to all of her appointments with her and her radiation appointments, the question was, do you have any suicidal tendencies? Do you find yourself depressed? Do you find yourself anxious? And at that time during the radiation stage, she said no. But of course, after that, going through that major life change, she had her moments where she was anxious, where she was depressed, and the tears would come, just random like that. And then she was able to heal, through certain things that she was doing. So mental health is not just these two areas I'm mentioning, but I'm just giving you an example of areas that I'm focusing on now that are, even though it may not impact you in your household, you may know someone or heard of someone that actually experiencing these situations. Another thing as well is some people go through, changes through postpartum depression, menopause. There are highs and lows. Anxiety, insomnia, stress, those things, they go hand in hand because you have a hormone imbalance. This is what I've learned over time. My sisters went through menopause. My older sister, because she had to have a hysterectomy, she went into early menopause, and so she had these type of moments, these bouts of anxiety at times, and sometimes with depression, because, of course, hormones, everything went out of whack. Not out of whack, but there wasn't a balance. So I'm sharing with you some of the things that I believe can actually improve the quality of your life in the way of your health. Now, in addition to consuming, your beverages or your foods or working out or getting the right therapy, the right counseling, there are other things you can do that you can control. And I know you've heard a term in the media or online about superfoods. Superfoods actually is something that has been about for centuries. We see them in the Caribbean, we hear about them in Asia. There are actually some in here in North America, different parts of the world of Africa. But what are they? How do they help us? So I'm going to share with you three of my favorite superfoods. And these are mushrooms. Now, if you've heard of the term mushroom that's been trending, in the magazines and online for like the last 10 years, you may not have paid attention to that. And some of you may be aware already. But one of the things I actually love is Ganoderma. Ganoderma is also called reishi or linseed. So in Japan, it's called reishi. In China, it's called linseed. If I pronounce it incorrectly, I apologize. And in the Western world, it's Ganoderma. Now, in the Health Canada, we have the National Product Number approved to say it actually supports the immune system, but there's so much more benefits to this actual herb. I call it, it's actually herb, it's a mushroom. Cordyceps is another powerful adaptogenic form of mushroom that actually supports the body overall well-being, not just for anti-aging, but as you're on the inside, it helps your overall well-being, provides many types of benefits, which I'll share in the further slides. Lion's mane. I've recently started consuming lion's mane through one of the beverages we have in our platform. And I found that my cognition, my thoughts, everything became clearer. Sometimes we have the brain fog thing happening, and I don't know in what case. Sometimes you lose sleep or a different season in life, but also stress can cause a lot of triggers, right? Sometimes you might have trauma. There might be different things that you may be going through, but you're taking something, you're consuming beverages and foods, your everyday items that you have, through your grocery that you purchase for your home. But consider superfoods to add to your meal plan. And how can you have that? So I'm going to share with you a couple of things, and maybe just to put that thought into your head. Now, for those of you who like fruits or vegetables or both, there's a certain amount of food, in the way of quantity that you have to consume to get the full benefit for the vitamins and minerals in addition to your supplements. So for example, the Ganoderma, which is called the king of herbs, actually has high levels of nutrients, minerals, antioxidants, and much, much more. So for example, let's say you love orange. Most of us are told to have one orange, not more than that, because you can't have too many fruits because it's not, in balance with what you're supposed to have for your daily consumption. Or you may have vegetables, you may have 2 or 3 servings, but you can't have more because it's too much for the body to consume and to break down because, you can't eat all day long. So for example, broccoli, you have to have 16 times more of the broccoli to get the full benefits of the magnesium that your body needs. For omegas, you need to have 8 times of the omega-3 fatty acids to be able to get the full benefit of what the Ganoderma can give you. Now, and the Ganoderma itself is one of the most alkaline mushroom, or I would say superfood on the planet to date. So if you look to the right, you see a few of the superfoods, which I actually recommend as well. I actually love spirulina in my smoothies. It's really good for brain function and for many other things like anti-cancer. Reishi, aloe vera, in the Caribbean, we know a lot about that. And there's so many things that are good for you, but none of us are fully aware, educated about the extent of how good they are until you start consuming it and your body start telling you exactly how it feels, because the body never lies. It tells you exactly how it feels. Now, Ganoderma lucidum has many, many benefits. Now, when I state that I'm not a practitioner and I'm not giving health advice, but I'm a health enthusiast, I'm sharing with you things that I've had experienced or had my family or friends and I've gotten feedback, but also have done my due diligence. So anything I quote here comes from credible sites. So for example, the National Health medicine website, which is called PubMed. It's National Health Library, sorry. It's called PubMed. You can do your own due diligence as well. And you can take screen captures of this if you'd like to. Has a lot of data, research, findings, doctors that's pouring into that site to provide knowledge for other people within that field, especially for myself who's not in that field, but I love research a lot. I love getting data. So in this Ganoderma looks like a very hard shell. So that's a protective shell that protects it from, insects and all those things, so that nature sort of likes to eat away at with certain things. But inside of that fruiting body is where all the nutrients and dense is packed. So Ganoderma, here's one of the PubMed that I was able to, when I researched in that on that site, which is not part of our company, not part of affiliated with us. It's just a third-party tool that I like to use to be able to get information. So the PubMed in there, it states for this particular PubMed ID, it defeats stress and depression. It actually reduces the inflammation in the brain and the body. And so it is also linked to helping the major depressive disorders. So that's a wide category for major depressive disorder. Ganoderma as well is anti-inflammatory. And so when we look at different things like I mentioned before, someone who's pregnant and they go through certain things, mood swings and, hormone imbalance, and then after birth, you may have, depression. But also there's such a thing as separation anxiety that can happen between mother and child. So this induces anxiety. That's one way as well. So that's like a mental condition that you may be going through. It's anti-inflammatory. As I mentioned, it helps with reversing or reducing inflammation in the body and the brain. And also what we've been able to gather so far over the last several decades. And there's over 3,000 case studies in PubMed that you can take it at your own leisure and you can do your own research yourself. But what I found was in this finding is that there's no adverse effects on the immune organ, liver, renal function, and also it's a promising candidate to treating ELS-induced psychiatric disorders. So there's a lot more research being done to be able to bring something that what Mother Nature intended for us to consume and to be able to benefit from that many people aren't aware of, right? So as you know, I find myself being sort of like a health enthusiast ambassador, but I want to share the goodness of what I'm finding. Another one is the cordyceps I mentioned. There's also finding that it helps with anxiety and depression. So it's considered with all the tests and the result that came out that is an antidepressant. It provides the experience of an antidepressant-like effect. It's also used for people who have seizures, like epilepsy, and also reduces anxiety levels. The other thing too, well, it alleviates depressive behaviors and also chronic mild stress. So what is this cordyceps? It looks like a bunch of like noodles, so to speak, right? But really it supports so much more. Like it helps with your overall well-being in certain things that you may find that you may experience where I may have a different experience. So someone might have anxiety where I may not. So they consume this cordyceps and they can have that experience where for me, I might find that, my energy level is down, or I find that my brain's not functioning in a way I find kind of like a bobblehead, so to speak, or I'm looking for anti-aging. Well, I think we're all on here, we're all beautiful and we don't need it, but I'm just saying it's there. And so this is some of the things that actually attracted me to learning more about cordyceps. Lion's mane, which I mentioned before, which I started consuming recently. I think it's about almost a year I've been consuming it. And I found that when I consume it versus when I don't, I skip a day or I switch to something else, I can feel the difference. So what it does for you is different than what it be for me, because everyone's body is different. You have a different genetic makeup. We all have different DNA. So of course, what you like and what I like might be different, but for me, I'll tell you this much. No matter how good it is medicinally, if it doesn't pass the palate, I am not consuming it. So you may be like me, but if you like things that says, it's good for the body, you consume it anyways, that's best you. right? But I'm just sharing this with you, my personal point of view. So lion's mane actually is really good for your cognition. And we actually have weekly conversations on health talk for different things. There's one of a discussion I'm going to have in the near future about brain disorders like Alzheimer's, dementia, cognition, different things that I believe that not just for pharmaceuticals, because everything has a purpose and a use and a benefit. You're taking pharmaceuticals. I'm not here to dissuade you from doing that. But what I've learned is that when you consume, medicinal mushroom, when you consume that, there's no adverse negative effect with what you're consuming. And the reason I share that is that when my mom had her second stroke a few years later, I wanted to give her things like turmeric and ginkgo and all these things. And I actually consulted with the pharmacist and I took her blister pack with me to the pharmacist and I says, can I give this with my mom? And they said, no, you can't do the turmeric. You can't do this because she had a beta block. And then she had blood thinners and so forth. So I couldn't give her turmeric. She had a mild case of dementia because it was something that's linked to diabetes, which I'm not going to discuss here, but this is what I was told by when we did the test. And that's in Oshawa, which is the Lake Ridge Hospital. But lion's mane it's so many benefits, not just for individuals who've had, let's say, ADHD or autism or, just for anxiety, but it has so many things. Like, for example, I mentioned cognition. And so mental energy is something that is real. Like if you find you're fatigued, you find you have a brain fog, you're not thinking clearly, you just feel a little bit off, or you feel way off. Mental energy is a real thing. So you can take a screen capture of this one if you desire. But for me, your mood is also super important as well. I was speaking to someone 2 days ago, and she was totally drained. And she's going through perimenopause. And so her cycle came back after 6 months, and her mood was like, her energy, everything was off. Her thinking, everything was off. And we talked about the winter months. You're not getting enough sunlight, not enough vitamin D3. You're on artificial lights. Things like this can contribute to the environment, can contribute that you're in, right? So again, to be mindful. So I want to share with you this part. And this is actually one I'm super excited about. Now, our company, Organo, a Canadian company, provides a healthier lifestyle ability or solutions to be able to share with you a treasure of the earth, or treasures of the earth, which I know has worked for my family and I. And for those who've consumed it, we've gotten great feedback. Now, what it does for you, I can't tell until you actually consume it. But if you so desire, then I can share that with you. So we discovered health and wellness through Organo by accident. We became customers about 12 years ago. The company's over 15 years ago. We started consuming it, started noticing things. And then if you're an overall healthy person, you don't see it right away. And this took me about 3 weeks to realize without changing anything else in my diet and not taking, I'm so bad at taking vitamins, but I do my best. Cross my fingers on. But I started consuming and switching out my brand of teas. And I wasn't a coffee person, so I loved hot cocoa. Remember I mentioned? Chocolate is my middle name. Well, I started having the hot cocoa and I found differences in my overall well-being. And then you're consuming something without realizing that you're actually giving yourself your body what it needs. So our company provides the top quality of these mushrooms I mentioned to you in different forms. Now, the capsules the Ganoderma comes in 3 stages. You're looking at the fruiting body, which is called the Ganoderma, the roots, which is called mycelium, and the spores, they're little seeds that sort of, they do what they have to do and they germinate onto plum logs and they birth more. So we have a patent on that it actually helps your body stays in your body 99.9% bioavailability, where it stays in your body and you don't really like pee it out, so to speak, for lack of a better description. And so I'm sharing with you these capsules, which have vegetable casing for anyone if you're vegan or you're not eating any type of meat product. But I love the fact that you can consume these, but one of the most important things, you can actually cook with some of these. For example, I have a friend and she loves the spores. She opens it up, like I make them in my pancakes or my waffles, and I'll eat my eggs and I cook with it. The gandum itself as well. The mycelium, no, it's a little bit bitter, but I believe you can consume it on its own. But the mycelium, which I found in PubMed, this is also through PubMed as well, it has anti-convulsant properties, antidepressant properties, and anxiolytic, if I'm pronouncing correctly, like effects. So also beneficial for those who have seizures. And also it has its anti-anxiety, it helps with pain and also with depression. So it's like a sedative without the negative side effects. Because what Ganoderma is considered two categories: food supplement and medicinal supplement. So there's no amount of you can consume it without any type of toxicity. So sometimes you take medication and it becomes too toxic for your body. Your kidneys, livers can't filter it. But with this, it helps to detox your body naturally of things that it's not supposed to be in your body, right? So we also know that a highly inflamed body is a toxic body. A highly inflamed body more prone to illnesses. So I mentioned there's a few other conditions that I found with the Canada under this PubMed study, and I just sort of put it in here as well. But it is, I mentioned to you that my mom, when she had the stroke, they were concerned about depression. They also wanted me to monitor her heart for 2 weeks. So she had a heart rate monitor loop on her for 2 weeks. And of course, they found a murmur, like some space of 6 minutes. And so they started giving her the beta block, a half a capsule. And I actually continued giving her coffees and teas with the cannabis in there, so that any type of medication that she was taking, she gets the full effect, but it would release the toxins from her body, because we know things like metformin and all other things like that, they are side effects. So her kidneys were fine. You know, the heart medication she had to take because there's certain things that she was not doing in the way of the right foods and lack of exercise. So not to blame her, but this is how the reality of our lives were at the time. So information has been linked to so many things. The brain can be highly inflamed, the body can be highly inflamed, right? So any questions you have, I will be more than happy to address them. If you can hear me, please put a thumbs up in the chat, and then I can, or if you need me to increase the volume, let me know, but raise your hand or put a thumbs up if you can hear me clearly. So another thing too as well, I mentioned about the separation and all of that with the different types of conditions for inflammation. There's another PubMed study that you can actually screen capture here, and you're able to get that information as well. Now, one of the things that I absolutely love is I love tea. You may not like tea, but I love tea. So for me, it was an easy win when I switched from my Earl Grey and my green teas and other things, my herbal teas, to this brand, because the mind is habitual. It gravitates to what it likes. You able to consume things that brings pleasure to your brain, to your body. And so drinking my teas, that was like, a comfort food for me. So I switched it to the beverages, which were the tea. And as I mentioned to you, I started noticing things. And so in our red tea, which is organic, and there's no caffeine at all in there, the cordyceps is infused into there, and so is the reishi. So there's many benefits. You're getting, best of both worlds. And so the tea is South African voice tea. And so that also has benefits as well. So you're getting a trifecta of benefits from those three things. Cocoa is another thing as well. So I mentioned to you that, in the earlier part of this presentation, that there are individuals, young and older, who suffer from autism. Now, a lot of feedback has come back from one or two people who started consuming or giving it to their children, the hot cocoa, as well as the capsules. and they noticed a difference. So, for example, the writing, with someone who has ADHD can be not as legible. And as soon as they consumed a cup of hot cocoa, they started noticing a difference. Now, is it a hot cocoa? No, it's not. It's the cocoa is a delivery mechanism. What it is the Ganoderma or the reishi. This is my go-to. I actually bake with this. I love making, carrot, red velvet cake with this, but I digress. But I just thought about that right now. But the hot cocoa is one of the things that the whole family can enjoy and still get the nutritional value you need with that superfood infused. So imagine you consuming it along with what you're eating, the right foods, the right diet, the right activities for overall well-being. Another thing as well is this is I mentioned to you about I started consuming the lion's mane. Well, I was never a coffee drinker. I couldn't drink coffee before. Some people mention, oh, they drink coffee and they can focus. I was the opposite. So I stuck to teas. But other people started consuming this brand, this Royale, we call it. I believe it's Supreme, but that's not the name. The name is Royale. And we have so many people responding to us as to what it tastes like. And then they have an experience. So the three superfoods I mentioned before are infused into these. And the lion's mane, the cordyceps, the reishi, all three provide these powerful benefits like antioxidants and the right nutrients and minerals and amino acids, all of these things. That's not my saying, but what the findings are. And you're consuming this every single day. Your body will actually tell you exactly how it's feeling, what the end results are once you're consuming it. You find you may have a better quality of sleep. You found that your energy level, or you find your anxiety has gone down. You find that in maybe your stress level sort of has balanced out or been reduced. So one of the things that I like about this too, there's such a thing as the, gut health, the gut brain connected to your gut. So if it's not sending the right signal, of course, your gut's not going to cooperate. So that's another part of your mental health, because if your gut is right, you find that you're able to perform better. Your brain is actually cooperating and sending the right signals. So another thing I want to share with you is just some of the brands, some of the products we have. And they all have infusion of a superfood. But what stage of growth is infused into the products? It depends on the one that you sort of want to gravitate to. So the Cafe Supreme which I actually had today, has ginseng, Ganoderma, and Tongkatali, right? Tongkatali is something that a lot of the bodybuilders use for recovery and for muscle repair. But I want to mention the ingredients for those. There's a hot cocoa I mentioned, there's latte, there's mocha. But the king of coffee has the spores, which is the seeds I mentioned, which is considered 17 times more powerful than the actual body of the Ganoderma. The mycelium has a lot of benefits as well. And there's one teacher, when they had the lockdown, I believe there was a scare with someone who was threatening the schools to shoot schools to kill people, and unfortunately a lot of people got scared, and it was actually a threat. And her son was consuming the mycelium, and she was developing anxiety because she had to go back to school. And she decided just to have the mycelium for herself. And the mycelium, she noticed after taking 2 capsules, she noticed that her anxiety started reducing. Now, is it going to work for everybody the same way? But that was her story she shared. And so you have the ability to impact your health and to be able to improve your health in a better way. I'm going to share this video with you. This is Kerry-Ann, my husband, and this person to your right, his name is Sachin Patel. We're actually going to be seeing him on the weekend at a gala, and he has a functional medicine practice, and he goes around the world and he trains doctors. So I want to actually just hear this video, and then after that, I'm just going to introduce you to my friend Helen Champagne, and then she will share her information as to her area expertise.
My name is Kerry-McLean. I'm here at Organo Weekly Meeting, and I'm here with my guest speaker, Dr. Sachin Patel. He's going to share with you why Organo and what this has done for his business, as well as the growth with his partners, business partners, as well as client base as well. Do you mind sharing your journey here with Organo? I know it's been a short while, but it's been a very fruitful experience.
Yeah, thanks for this opportunity, and hello everyone. My name is Sachin, and one of the things that I really love about this business is the opportunity to share and to surround yourself on a weekly basis with people who are very positive and uplifting and are not only inspired by you, but also inspiring because we all have our own stories. So I'm a functional medicine practitioner, and I retired from clinical practice about 2 years ago because now what I do is I coach doctors all over the world, and I teach them how to help patients heal naturally through lifestyle interventions, through nutritional interventions, through environmental interventions. So we really help people get well by helping improve their cell biochemistry, by improving their environment, by improving their relationships. And one of the things that I came across in the last year or so is the power of medicinal mushrooms. And so this opportunity kind of came to me at the right time when the student was ready, the master herb appeared, that being reishi. And also my mentor appeared in my life, Dr. Bob Rakowski. And so, Dr. Bob is just a wealth of knowledge, just an amazing person, very giving, amazing speaker, great educator. And so to have someone like that, endorsing the product, and to have someone like that who's also supporting you in endorsing the product meant a lot. In our practice, there's 3 things that we have our patients cut out almost immediately. So one is their gluten, right? So bread products, anything that has wheat in it tends to be very inflammatory. The other one is dairy. Dairy for a lot of people can be inflammatory. And the third one for some people, depending on their state of health, is actually their coffee. And so people are okay with cutting out their gluten, they're okay with cutting out dairy, but once you get to the coffee, they're like, there's no way, right? They break down, like, oh my God, what am I gonna do? Because it's become a habit or a ritual for them. And so this product actually solved a really unique problem that we couldn't solve otherwise. And that was, now when they drink their coffee, we're actually putting a medicinal herb into their coffee, so they're actually feel good about making that recommendation. So that's really where it started, is coming up with a retail alternative to what they're currently using. The product is way better than what they're currently drinking, and it's also something that is cheaper than what they're currently drinking. So there's really no objection that you get from people. And once people get their software upgrade, because I truly believe that reishi is a software upgrade for people. Yes, it has, it's a superfood, so it has all the nutrition in it, but it's also a software upgrade. And people notice a difference in their consciousness, and their awareness, and their inflammatory markers, and all of their health parameters start to improve very quickly. So I was telling everyone a little bit earlier, we have patients who were struggling with health challenges even after going through our programs. They felt better, but they just weren't all the way there. And a couple of cups of coffee and tea can make a profound difference very quickly. Specifically Organo coffee and tea. And I had a lady come to my house, and she drank 2 cups of tea and had a regular bowel movement for the first time in over a year. So people can notice a difference very, very quickly. And the reason I believe is it's because what most of healthcare focuses on is the hardware part, right? So we take pictures of organs and we take blood work, and that's looking at the hardware, but what we can't see is the software. And so reishi is quite profound, and that's why it has so many benefits. The one thing I tell people is that when the true cure comes along, it will make such profound claims that it will be met with skepticism, right? So if I tell you there's something that can fix almost every condition known to man and all you have to do is drink it or consume it, people are going to be skeptical, right? So they have to experience it to really feel it. The way medicine and the way supplements and all these industries are set up is that we give people a pill to treat a specific problem. And if we give them a drug to treat a specific problem, it usually comes at the expense of healthy systems in their body. So if I give somebody a drug to lower their cholesterol, then I lower their cholesterol, but I also destroy their liver. I destroy their brain. I increase their risk of developing diabetes. So that's not a cure, right? Whereas with reishi, when I give somebody reishi, actually, I just watched a video on this today. Their arterial plaquing reverses. Okay, their heart, their liver health improves because reishi is a master detox agent. Their brain health improves. Their immune health improves. Their gut microbiome improves. Their intestinal permeability improves. So virtually every element of their health improves. There's no known negative side effects of reishi, and there's no known toxicity for reishi. So it's just an amazing, we call it an herb. It's really a fungus, but it's just profound, the difference it can make for people. And once I started seeing the benefit in our patients, I started connecting with the practitioners that I coach, and I started studying, the model of network marketing, and realized that if you're good at sharing, because that's what this is, it's a sharing model. If you're good at supporting, and if you're good at, really giving it your all, right? And you have a product that you believe in, then this is an excellent business to be involved in, and it's an excellent product to be involved in.
Well, you've heard it here tonight. Wherever you are, whatever you're doing, reach out, try a cup, see what it does for you. I'd like to thank you once again for adding value not just to myself but to those viewing us. And it's been a pleasure, and I look forward to the many more interactions we'll have.
Absolutely.
Right? Is it okay for me to share this with people?
Please do.
Thank you very much.
Thank you, my friend.
My name is Corey McLean.
So, it is this gentleman, he's an amazing person. He's also a speaker and a lecturer, and like I said, he teaches other doctors with their practices as well. In the latter part of that interview, he spoke about the business model. We're not talking about that today. There is an opportunity if you're looking to start a business in the health and wellness or in that type of industry. We can certainly invite you to our business conversations we have on Sundays, but today is strictly focusing on the health aspect. So I'm actually going to stop sharing this because this is the end of our slide here. And I want to introduce you to my dear friend. Her name is Helen Champagne. I've known her for many years in another profession, but she decided to pursue her passion and her vision that she wanted to help people in a certain capacity. And so Helen is here in Canada. If I say correct, it's in Scarborough, I believe, or in East York. I tend to get my regions mixed up. My husband tells me I'm directly challenged, and I accept that. I have my other strengths in different areas, right? But she actually has a BA in psychology, a Gestalt Institute of Toronto diploma. She is a psychotherapist, and so I said psychologist, so please forgive me for that that mix up. And she's soon to be fully licensed with the College of Registered Psychotherapists of Ontario. So I'm so proud of her and what she's been able to accomplish. I'd like to introduce her to you, and she will be able to share more on her area of expertise. And so this is one of the reasons why I believe it's important that we stay informed. Helen, are you there?
Hi there. Yes, thank you so much, Kerry-Ann. That's very, very kind of you. I wanted to just talk briefly about my area of expertise as a psychotherapist is in neurodiverse presentations. So Kerry-Ann brought up the conversation about ADHD autism as part of her talk today. And these are neurodivergent brain patternings. And so what I wanted to briefly speak about is it became my area of expertise actually by accident. I was late diagnosed ADHD. Didn't know my entire life, just, went along with being told I was quirky, or, well, that's just Helen, or not fitting in, or the othering that goes with, somebody who either has autism, ADHD, or is highly sensitive. So in the range of neurodivergence is highly sensitive people or high sensation, highly sensitive people, ADHD, autism, Asperger's, and synesthesia. Synesthesia is when senses are confused in the brain. So you actually taste color. So you visually see color, but there's a sensation of taste in the mouth. Or you will taste fruit and then there's an auditory sensation. So somehow the senses are kind of mixed up. And there's a range in each presentation. So the one thing that I have to say that I'm really happy to experience as a practitioner is hearing psychotherapists, psychologists, and psychiatrists speak about the range in any neurodiverse presentation as it's a brain pattern. So it's not something that's abnormal. It can become disordered for somebody who is at the top of the range. So for example, if we're going to look at autism, the range is to be, gifted and highly intellectual to non-communicative and sometimes aggressive. And the aggressive is not a presentation of there's something wrong with that person with their anger. It is about the neurobiology being unsupported and the frustration that goes with it. So I fell into it accidentally, taking a seminar on HSP. The Highly Sensitive Person is a book that's written by Dr. Elaine Aron. She's an American psychologist who's done this research for close to 40 years and talks about what it is to be a highly sensitive person. And the other presentation that goes with that is to be high sensation seeking, highly sensitive. So high sensation seeking, when somebody is like, they're attracted to this high octane behavior or the excitation of like cliff jumpers, people who ride surfs, like who travel the world to catch a 30 wave surf. So they live like a high octane life. And sometimes for individuals that, don't get into extreme sports, but get into extreme behavior, whether it's the excessive use of drugs and alcohol, racing their cars, whatever the behavior looks like, it's misconstrued as there's something wrong with that person. And the only thing that exists is a brain pattern that's not supported. In our conventional society, we're conditioned that we go to school from 8:30 till 3:30. We go into the workplace from 9 to 5. So the neurotypical world is built around that. The neurodiverse world is a much smaller presentation, forced to fit into that. The last 20 years of research has really brought a higher level of awareness of what it is to be neurodiverse. With my clients, I tell them it's a gift to be neurodivergent. And when you learn what the gifts are and when you learn what the self-care is behind those gifts, then we find our own tribe. So a lot of kids in school who either get missed because, so I'll give you myself as an example, which is also very, very common with people who are late in life diagnosed with ADHD. There might be some mild behavior, but it just looks like something that's quirky. So it isn't to the level where a teacher is going to say, we need to engage the school psychologist to do an assessment and see if the child has autism or ADHD, which are the two more prevalent in the neurodiverse brain patterning. So these kids go along getting missed, not quite feeling like fitting in or experiencing othering. And as the child grows up in this field of being othered constantly, either by parent, family, friends, teachers, social environments, they actually embody what it is to be outside of what the norm looks like. And that can cause depression in and of itself. So a lot of clients that either I have seen or my peers have seen who are not, they're missed in their diagnosis. They're given antidepressant medication. The antidepressant medication is not going to work for those people, or it'll work for a while and then it's going to stop working because the root cause is not what is traditional depression. The root cause has to do with neurodivergent brain patterning that is not supported. So I just wanted to talk just very briefly about, what this particular sphere of work looks like. It has become more prevalent in the world today as there are significant percentage increases in autism. They attribute it for different reasons, and ADHD, environmental factors, nutritional factors. I truly believe Kerry-Ann is bang on when she talks about nutrition. I do a lot of webinar learning with regards specifically to ADHD and autism, where they do talk about, how can you support the system? Nutrition is prevalent. I also tell my clients, for those of us who are neurodivergent, whether you're a little bit or a lot, we are high maintenance. And I say this with compassion and love. And it simply means we need to have the proper type of nutrition, the proper type of supplementation, the proper sleep hygiene. So it's like the neurobiology of somebody who is neurodivergent is extremely sensitive. It's sensitive to the environment. You can't shut out any kind of environmental factors. So your five senses are on 24/7. A neurotypical person can actually focus, go to work, sit and do a really boring rote job and finish and be done with it by the end of the day, and all their stuff gets done. And the rest of us are kind of like, I can't keep up. And a lot of that has to do with the fact that our senses are on 24/7. And so our bodies and our neurobiology is taxed. It's kind of like going to work with a 100-pound sack on your back. Okay. The odds are already stacked against you because you can't shut it off. So we're the type of people that will hear a tiny drop in a faucet that's in the bathroom in the next room. Okay. And it catches our attention. And the neurotypical person is going to say, what drop of water? I don't hear no drop of water, because they can totally shut it out. So everything that we experience from a sensory perspective, how hot or cold the room is, how many people are in the room, everybody's energy, the more people there, the more your body feels it. We're the type of the people that can walk into a room of strangers and we're going to feel the person who hates us, because energetically, you can sense that what's coming at you from another person. We're highly empathic people, very, very compassionate. And so what ends up happening with somebody who is highly empathic, highly impassionate, highly compassionate, highly sensitive, feels that sensory stimulation of all their senses 24/7, is your neurobiology gets really tired really fast. So I just wanted to briefly put out a little bit of information on, what it is to be in the neurodiverse spectrum. There is nothing wrong with it. There are gifts in it. It does require a lot of self-care and learning about that self-care. This is not to say that, that is everyone's experience who's neurodiverse. There are the extreme brain patternings of, ADHD and autistic children who have a tougher time with it. But I'm really talking about the middle of the pie, which is quite common, in the everyday population. We look forward to research that will look at the brain, the map of the neurodivergent brain a little bit differently. And why I say that is, if you were to look at all the different presentations, in a psychiatry journal, and the features that each one has, the overlap for all of them is the same: overstimulation and overwhelm, depth of processing, empathic ability, and highly sensitive in terms of sensory stimulation. And so all of these factors exist with all the presentations. That's what's consistent across the board. So what research is finding today is that there are more commonalities with children who present with both ADHD and autism. There's a new term now for it called AUDHD. And so that's what's coming up. The Theories behind it are many, but I do believe, like Kerry-Ann has mentioned, nutrition is definitely a factor. Nutrition in and of itself is not going to heal a child that has ADHD or autism, especially if they're high in the spectrum. But it's one of those things that is part of the self-care need, for those children. It makes a difference. Makes a difference if you feed an autistic or ADHD child processed foods, like frozen foods, which is common now because women are working, they're tired. Who has time to cook, much less to cook healthy? But it does actually make a difference if you eliminate packaged and processed foods from the diet of a child that's neurodiverse, or for those of us who are adults. My journey into improving my health again has a lot to do with completely eliminating sugar. For one thing, I have stage 2 fatty liver. If it got any worse, I'd be looking at liver cirrhosis. So it kind of really scared the bejesus out of me into looking at how I eat and how to change how I eat. So I know that these things make a difference. There's research out specifically with comorbidities with ADHD, meaning the things that actually go hand in hand with individuals who have ADHD. One of them is seasonal affect disorder, which is not highly spoken of, but it's actually prevalent. And so in the winter months when there's not enough sunlight, again, there's a range. There are the kids and adults who will be impacted to the degree that they'll be forced to find a doctor who can assess them and to get a sun lamp to support them. And then the other ones that will not be highly impacted, but their bodies are a little bit more sluggish during the winter time, in the winter months when there's not enough sunlight. The other thing is supplementation. So when we look at the North American guides for supplementation, the standards are lower than the European guides. So the European standards are higher for supplementation in terms of what I mean by higher. If the daily allotment for vitamin C is like 1,000 milligrams in North America, in Europe it might be 1,500 milligrams. So their standards are higher. Personally, this is completely a personal level. This is not from a learned place. I think that they're better. That's just me personally, because I know that as somebody who has neurodivergent brain patterning, I actually need more. And when I speak to my clients about this, I do tell them to discuss this with their naturopath so that they can get an appropriate blood type, blood exam done for where they are with their supplementation and to test it out. But what is known to be true based on research is that whatever the standard, if you're going to look at the European or North American, if the standard is, the middle of the pie chart, anybody who's neurodiverse falls on the outside of it. We are the outliers. So if 1,000 milligrams was the standard vitamin C supplementation, we need more. And the reason being is we will burn through our minerals and our supplements for the very simple reason that we are overwhelmed by our sensory exposure to the environment and all the information that we take in that we can't shut off automatically. So definitely can be taught how to self-regulate, how to isolate and have downtime, how to teach a child how to minimize screen time, or even to wear orange goggles with screen so that the blue light doesn't impact them, especially if they're going into the later hours. Because the other thing that is true for children and adults who have ADHD and autism is that sleep cycles are more easily disrupted with this particular brain pattern. It's something that is highly researched and it's definitive. So I could really go on for a couple of hours talking about ADHD and all the comorbidities and all the self-care. But I thank you, Kerry-Ann, for the invitation to your group and to be able to speak a little bit and just put out some information with regards to this. And I'm happy to send you some resources that you can channel out to the group and your friends.
Thank you. Thank you. This is an eye-opener. So as I prepare this presentation, I'm writing notes on what you're sharing from me
Okay.
because we all are students in some form. All right. We always
Yeah.
want to learn. That's how we get better and better. So I actually have a couple questions before we wrap
Sure.
up. And I will be saving this. We have a Facebook group, which I did invite you to, so they can, the recording will be there. For those who were not able to attend because of schedule, I believe if not tonight, by tomorrow, I'll share it there so that others can be aware of what you have shared with us. And, if just maybe 2 or 3 minutes, I'm just gonna just quickly see what questions are here. And then we can just, I'll give you back your time for the evening. So I see there's a question here. I'm just gonna go from, there was a question about what about fast foods, from Deborah.
Right.
Yes, so that's one thing too.
So with fast foods, again, nutritional counseling is not my area of expertise, so I'm going to only speak to my personal experience. And again, there would be a range. When you think of where are you picking up your fast food, are they using like seed oils? Are they leaving the oils like in the fryer for a year, right? Where the more time that a seed oil gets heated, the more toxic it becomes over time. So these types of things add to the toxicity of food. Um, if you look at fast food like, I don't know, like Tim Hortons, the sandwiches that you pick up that are they're not deep fried,
Mm.
there's luncheon meat. When you look at the luncheon meat, again, you'd have to consider there's going to be nitrates in it. And, you know, is it a better quality luncheon meat, like processed night versus like the cheaper quality? So you just don't know in terms of what the sourcing is. So that's why I don't want to speak to all fast food is awful or
Yeah.
garbage. I only want to speak to figure out where is it that you're going? What do you notice? Like what do you see? And what do you taste? I mean, there's going to be a range, just like in any kind of food stores, from like bottom of the barrel, don't bother, you're putting poison in your gut, to it's okay. You know what? It's your body's going to get some nutrients. And if this is the best option right now because life is just so busy, then at least you're picking the best option out of all of them.
Yes, and thank you so much. So Natasha actually sort of mentioned something to what you said, that her son, her youngest, has Asperger's syndrome and
Yeah.
ADHD. So he hates those kind of foods. Like I hope I didn't take it out of context, Natasha. So basically, the palate doesn't lie. It tells you exactly if you like it, you don't like it. And children, with those type of symptoms, there's no filter. They tell exactly. They like it, don't like it. It's like, someone who is like a baby. You put it in, they spit it out. But in this case, they'll tell you they don't like it, right? So, another one, that's one more question I believe I
Before you
hear.
go to the next question, would like to add to that very quickly, Kerry-Ann. The palette with children who have Asperger's and autism, the sensitivity, has a lot to do with texture as well as taste. And even, so I'll just put myself in the mix. When I was little, my mom used to make Lipton's chicken noodle soup. And it had those like little green bits because that was like the parsley or the herb.
Yeah.
And I would pick out every green little bit because it annoyed me. And my mother would just freak right out. Now, neither my mother
Oh.
being like an immigrant would never have known to understand, what is Asperger's, what is autism, or even to consider that her child has it, saw a peculiarity. So I grew up with being the peculiar kid that always was picky with food, but it does get more severe with Asperger's and higher ranges of autism because of the texture. Again, it grates on their skin if it's either too slimy or too rough, even clothing. So something that's wool that will be pinching the skin, like they can't handle certain textures. And all of this is because of what it's doing to the neurobiology. So it's not the child, there's something wrong with their brain. It has nothing to do with that. It is all about sensory processing. So their senses are processing something to such a high degree that they can't handle it. So it's just like, no, get this off me, or no, like, I'm not going to eat this, right? And so to a neurotypical person, it was like, what's wrong with this child? There's nothing wrong with the child. It is getting to understand, what does their neurobiology tolerate? You will find something for them. I have an adult client where that's what we're working on right now in terms of how to expand the tolerance in her neurobiology. So sorry, go ahead, Kerry-Ann, and answer the.
Thank you for that. I appreciate that. So that was the one of the things. So the overall reason why we wanted to, yes, we're building awareness, which is great. You're doing a fantastic job of sharing the information, of course, your story. Many people, sometimes they're very private, they don't want to share. So thank you for that, for sharing from the heart. And we appreciate your time. And for all of you here, I won't keep you too long because we've passed the hour that I had designated for this, but this is such an interesting topic to talk on. And it's not just a topic, it's just like life, how the individual life experience for each person who's going through that over their child. Is there a question that anyone wants to ask? I think they can take themselves off of mute, and then we'll wrap up in about 2 minutes. And you don't have to be shy. We can, it's a safe space here, so we can, we can be more, if we're able to have the answers, we're able to help you with that. Okay, so there are no questions. Oh, sorry, go ahead.
Yes, I wanted to know if you had any idea what like the ratio in for like autism and also the ADHD, those type of children or people, what is the ratio in a family? If you have any idea.
Okay, that's a good question. I don't think there's definitive research specifically with ratios with families, but what I can speak to is this. There is a biological disposition, with neurodivergence. It's a brain pattern, so it's inherited. That doesn't necessarily mean that, again, it's a bad thing or that it's going to present in a horrible way. I think one of the best books that I've read so far with regards to inheritability with ADHD and autism is Scattered Brains by Gabor Mate. He really presents the argument well for, yes, there is a biological disposition for it, but environmental factors are going to push it and exacerbate it. And you can also minimize it and bring it back down again. So what is researched is Elaine Aron's work on HSP. So it's 20% of the population. So if you think of 7 billion people on the planet, actually more than that, 1.6 are actually HSP or HSS HSP. The autism community does not consider that HSP and HSS HSP is a branching on its own. They consider that it's a higher form of autism. That's definitely a possibility. I would never dispute that it's not. If anything, I would say probably is. And it's not to take away from the research that Elaine Aron has done, because her research is really just specifically on being a highly sensitive person. And it brings in a lot of light as to what are the features? How do we support the feature? How do we take care of somebody who has depth of processing? Okay. When I tell my clients, I take so long, it's like, okay, so I tell them the story of when I bought coaches one year. Okay. That took 13 months to pick a coach. The normal person was going to go into the bay, they're going to go into like
Hold on a bar.
wherever they're going to go into, and they're going to pick a coach and they're going to say it's going to be delivered. I had to see every coach manufacturer all the way over to Cambridge. It's just the way my brain operates. I have to see so what I tell those people is depth of processing can be a gift, and you can really learn how to narrow the playing field of what you're looking at. With discipline and with time, eventually you're going to say to yourself, okay, I just wasted way too much time picking the perfect pink color for my child's bedroom, right? Eventually you're going to realize, so her work is
Mm.
40 years worth of hard work. She has a website. I can send the resources to Kerry-Ann and she can cascade it out. But if you just Google HSP, the highly sensitive person, hers is the first one that comes up. You can just read about it. There are 2 self-tests for anybody who is neurodivergent. I did see someone in the chat saying that they were and all their children were.
Gotcha.
So you could do the self-tests and just see, where do you fit on that? All all of this does is it gives you information and an insight as to who am I in this body that is highly sensitive, that is reactive to sounds, smells, people. I have to say, as awful as COVID was, for me, what was great about it is I had to stay home. I had to go online to see clients. And it really taught me to just slow down and just not be out in the world and just say, hey, you know what? Staying home and cocooning is actually a good thing. So it's
Recalibrate.
all about how to build self-care.
Yeah, I agree. Any more questions before we wrap up?
What's the best route to take to find someone who can help you with your especially if you're the person that's also neurodivergent and now you have
Yeah,
ADHD and autism kids to deal with?
yeah.
How do you go about?
So I will share. I don't want to cut you off. I'm going to share Helen's information. So if you want to reach out to her, because she has a practice that she can support in that capacity for certain things. So anyone who wants, they can send her email. Helen, you can connect with them, and you can continue that conversation. But sorry, I didn't mean to interrupt. You can continue, Helen.
No, that's okay. That's okay. Yeah. It is tough finding really good resources, so I'm happy to share resources. I work with children from teenage. I'm going to eventually take training to work with children. It is my passion. I want to reach the child at a young age. Like if somebody had reached me at 5 to say, this is what you're doing, this is what you're all about, like, it would have saved a lot of heartache and pain while I was in university trying to figure out what to do. So that's why I love working with teenage kids because, again, I can teach them there is nothing wrong with you. A lot of neurodivergent children have difficulty with friend groups because the majority of the kids are neurotypical, right? So to them, it's kind of like, you're odd. Like, what's wrong with you? And there's nothing wrong with that child. It's really finding their tribe. And they will after high school because they'll find more kids out there that are part of the population.
So thank you so much. So we're gonna wrap up. If there are additional questions, feel free. Once I put this in the longevity of organo private Facebook group, that you
I
can
would
add more.
really like to ask a
Oh,
question
sorry.
myself.
Go ahead, Pauline.
One of my grandchild, he's 4 years old. He's autistic too, but he's not speaking. And from he was born, he don't eat food up till now.
Okay.
And the doctor said everything is fine. He's healthy, everything. So they just put him on some supplement. Is that normal?
So what is typical with children who are autistic, there's a high percentage of the kids who they call it delayed developmental factors. So they'll start speaking a little bit later.
Mm-hmm.
Whatever the social skill, it'll happen later. So
Yeah, because he's in school daycare. But the thing about it, now since he's in the daycare thing, he's getting used to the kids in the daycare. They're playing together, and like the teacher said, he is good with numbers.
yes,
Not
yes.
because he's not talking, but he's good with numbers and those things. But I'm saying not to eat from a child, from a baby till now. What about his jaw? Like you, no strength in the jaw or anything. He just have his bottle. That's it.
Okay, and so he hasn't started eating like solid food yet?
Not don't care what the mother try him with. Nothing. And the
Okay.
doctor said, don't force him. Leave him alone.
Okay. So his doctor would know better because my area of expertise is not like a medical practice. However,
Mm-hmm.
I would like to say to you, I would trust the doctor in this. Simply
Mm-hmm.
because I have read how there is a developmental delay
Yeah.
and those children do catch up. He will start eating food at some point.
Okay.
I also think it's a good idea not to force a child, especially an autistic child, because it interferes with their process.
I
Okay.
think so because if sometime you try to like you don't really want him to get just the sub, like you try to put something else with that, but from he tastes it, he knows it's not the same thing, and
Right.
he won't have it.
Right.
Yeah.
But the doctor said he's fine and his health, his weight, everything is good.
If his weight is healthy, if his blood work is healthy, he's going to find his way eventually. And
Mm-hmm.
if you just go with where he's at, as long as the doctor is telling you you've got nothing to worry about in terms of his health,
Okay.
the child will feel more supported because like you didn't push him against what his neurobiology wanted.
Okay.
Right.
Okay.
And that could be just as important. If his weight was low, if his body weight was low, if his blood work showed like he was anemic, if those factors were there, then the doctor would say to
Mm-hmm.
you, okay, well, we need an intervention.
Okay.
But since those factors are not there, if his body weight is right, his nutritional content is there, his blood work is okay, he's saying he's getting everything that he needs from the bottle, go with it. Because psychologically, just allowing him to go with it also
Okay.
calms his neurobiology at the same time.
Okay. Thank you.
Okay, good luck.
Awesome. I love this. We could spend all night here,
Yeah, I
so I'm
know.
going to wrap up. But thanks again. So I just want to share with one thing. One of the things that I would like to, and again, I am not in that field. I'm not a doctor, medical practitioner, but any kind of nutritionist. But what we spoke about with the superfoods, the mushrooms, and you've seen the information, you could do your own due diligence. What I would maybe suggest, because we have kids who have ADHD who are consuming the hot cocoa because of the texture is a great thing, main thing, but the taste as well. So that could be as you introduce different things to different people who like, like for me, I gravitate to chocolate. I like chocolate. What can I say? But somebody might not like chocolate, right? But the capsules are really good because it can actually mix them with other things or consume. Now, some children don't like the feeling of swallowing capsules, right? So the fact that you can actually put it into food, into smoothies, and they don't taste it. All they taste is the goodness of the flavor. So you can reach back out if you have a nutritionist,
Mm-hmm.
someone who's doing studying natural medicine, and they know about reishi or Ganadem, especially a Chinese naturopath. They know that they can consume it, but I know I've been consuming it for over 12 years and also with the kids as well. My nephew, who's now 18, he's been drinking the hot cocoa since he was like a baby. I can't say baby, he's a big man now, but since he was about 6 years old, right? So
Mm-hmm.
everyone's path is different, and I would say this:
Yeah.
if you want to try something, try to see if it works, and then if the child or the adult likes it, then continue and then pay attention to how the body's responding. So that's the best
Mm-hmm.
way that I would say to approach it. So now it's half past the hour. The intention was an hour, but this is such a great conversation. I'm going to wrap up. Again, I'm going to save this into our private group. If you're not part of that, reach out to the person who invited you, and we can add you to that. And I'm going to have that video there so you can watch it. And if you haven't been able to take a screen capture, it'll be there so you can take all the information down. And I want to thank you so much for your time. It was a pleasure having each and every one of you here. Have a blessed evening, and I'm giving you back the time that you shared with us. All right, well, the rest of the evening, I should say. Have a great evening and take care.